A frozen shoulder can sideline you, sometimes for over 1 year. This can affect any adult, causing a really stiff and very painful shoulder, often without any memorable injury. So what is a frozen shoulder? How can we avoid it? And how do we treat it? Keep watching and I'll show you my 2 best tips. The medical term for frozen shoulder is adhesive capsulitis. It's just a fancy way of saying that your shoulder has become stiff and the ligaments around the shoulder, also known as the capsule, are scarred and thickened. People with frozen shoulders struggle to reach up, out, or behind their back. It can be downright painful to stretch the shoulder when frozen shoulder has set in. Nobody knows the exact cause of frozen shoulder, but it involves several distinct phases, including the freezing phase, the frozen phase, and the thawing phase. Certain medical conditions like diabetes and thyroid disorders can make you more prone to the issue. However, the most common for frozen shoulder is lack of movement for any reason. If you sprain your shoulder or if you have a chronic tendonitis, the natural response is to protect the shoulder and avoid the things that cause you pain. While that may seem like the right thing to do, it actually allows the problem to happen. You may think, it hurts to go to here, so I'll just go to here. But if you do, the shoulder capsule will tighten down and soon you will find that it hurts to even go to here. As you give ground, your pain-free comfort zone keeps shrinking and shrinking. So the first tip is this. If you have a sore shoulder, make sure that even while you rest the shoulder, you take it through a full range of motion every day at least once. The shoulder ligaments need constant stretching to remain balanced and supple. By reaching up like this, out like this, and up behind your back, you will not give any opportunity to the ligaments to tighten up. We can fix almost anything with the shoulder. However, stiffness makes everything harder to recover from. So, do yourself a favor and stay flexible. Let's say that you are already in the freezing or frozen stages of frozen shoulder. Here's a second tip. Like I said before, it can take well over a year for the shoulder to thaw out on its own, but you can speed up your recovery with consistent stretching program. We often send our patients to physical therapy and encourage them to work diligently on their stretches. In many cases, I will also offer my patients a hydrodilation procedure. This is an injection of fluid, cortisone, and an air bubble. We give this injection into the joint under ultrasound guidance. Here's an actual video of a hydrodilation ultrasound image. You can see that fluid, which is the dark area, expanding the joint, and the satisfying part is the air bubble. Watch. The additional fluid and the air bubble act like an air spring to push into all the stiffened crevices of the shoulder and to magnify the stretch. Combined with the formal stretching program, most people find that they start to make progress within 4 to 6 weeks of a hydrodilation injection. In some rare cases, we may not get the desired result with these types of injections, so we may offer patients a procedure where we stretch the shoulder for them while they are anesthetized, as in asleep. This is called a manipulation under anesthesia. While that may sound like the easy button, it involves some risks, and we like to reserve that for those who have already tried the usual options. In a future video, I will discuss some of the lesser-known nerve syndromes of the shoulder. For this and other topics on shoulder and arm health, please subscribe, and please share this video with anyone you think would benefit from this information. Take care of your shoulders and arms, and we will see you in the next video.